Some consider the timeline from birth to 2 years old to be the most crucial in detecting any developmental issues. After all, the sooner any problem is found, the sooner we can tackle any issues and set life-changing habits for our little one's best life possible. The following are some general milestones for child development by month, from birth to 2 years old. Birth to 1 month. Infants are able to focus on objects that are within 8 to 10 inches of their face and can recognize familiar faces and voices. They begin to develop the ability to follow moving objects with their eyes and can lift their head briefly when on their stomach. 2 months. Infants are able to smile in response to social cues and can hold their head steady for short periods. They can also bring their hands to their mouth and begin to develop hand-eye coordination. 3 months. Infants begin to develop stronger neck and trunk control and can hold their head up for longer periods. They begin to reach for and grasp objects, and can make cooing and gurgling sounds. 4 months. Infants can roll over from their stomach to their back and can begin to sit up with support. They also develop more complex vocalizations, such as babbling. 5 months. Infants can sit up without support and can begin to bear weight on their legs when held upright. They can also pick up small objects with their thumb and forefinger. 6 months. Infants can roll over in both directions and begin to crawl. They can also transfer objects from one hand to the other and begin to develop separation anxiety. 7 to 8 months. Infants can pull themselves up to a standing position and can begin to take steps when held. They can also understand simple commands and can point to objects. 9 to 12 months. Infants can take a few steps on their own and can begin to use simple words, such as mama or dada. They can also understand the meaning of no and begin to develop a sense of object permanence. 12 to 24 months. Toddlers can walk, run, and climb. They can also begin to use two-word phrases and can understand simple instructions. They can also begin to engage in pretend play and can begin to use the toilet. It is important to note that all children develop at different rates and these milestones are just a general guide, so it's important to consult with a professional for a proper evaluation if you have concerns about your child's development. As always, use your better judgment. You of all people should have the greatest understanding of your child. So if something just feels off, take that leap and talk with your pediatrician so that the proper steps are taken in maintaining your child's physical, mental, and emotional well-being.